I want to go back to one thing that you said earlier of physicians spending minutes, a few minutes with patients. As a neurosurgeon, even before I began to do integrative holistic medicine, unless it was an emergency and I had to rush to the operating room, I never spent less than an hour with a patient. And I remember one woman who came to work for us said a doctor told her, don't go work for him, he spends too much time with patients. I reached a point where I refused to deal with the insurance mafia. And I said, look, what I'm offering is so successful that I'm going to do it this way. And if people want to come to me, I'm not going to, the insurance is between them and another company, it's not with me. My role is to work with a patient. And there are a number of physicians who have done that. And it's worked extremely well for us.
Those of us who charge patients and say, listen, your arrangement with the insurance companies is yours, you tell me what you can pay me. I charge people what they can pay me. Some can't pay me, they still trade with me. I get glass doors from artists, hocks of ham, baked apple pies, because it reminds me of what it is I think that the healing art is all about. So it's hard to sustain ourselves that way. The industry of medicine has become an issue of profitability controlled by insurance companies who decide what it is that you can or can't have and how it is they can distribute funds to their shareholders and investors. That's how the decisions are made. So we have 3 new diseases in the last 2 years, just to give you an example.
What are they?
The last one just came out called involuntary emotional expressive disorder.
Another bullshit.
If you laugh or cry too much, you may be suffering from a disease. Now, we're not talking about...
Are you serious?
I'm serious.
Are you making
We've
it
all
up?
got
No,
that.
he's not making that up.
Involuntary laughing?
Emotional expressive disorder. Now, we know that there are a lot of people
What are
who
the
laugh.
symptoms?
You laugh
You and me
cry
have
a
got
lot.
it.
But it's not because you're suffering from a brain tumor, or you may have Cushing's disease, or you may be suffering from a dementia. There's no organic
You might
basis.
be normal.
You are just kind of laughing or screaming too much. 5, maybe 10% of the American population is suffering from this. And of course, we don't know how it's disseminated. We don't know kind of the paradigm of the disease. We don't know how it's transmitted, but we do know how to treat it. How do we treat it? Drugs, of course, antidepressant medications. Who are the people who are making these diagnoses? Well, you know, the DSM-3, the Psychiatric Diagnostic Manual, the Bible by which we define our diseases, is comprised of physicians, by and large, who are supported by drug companies, who are making diseases for which, interestingly, drugs are the cure. The longer we continue to be controlled by these kinds of determinants, the less likely we are to make connections like the ones that we are talking about.
Yeah. I mean, that's exactly what I was saying. I mean, you talk about the culture of narcissism. I mean, the whole of our healing is based on narcissism. Find out who hurt you. You know, it's a whodunit. It's a crime-solving mission. Go find out who committed the crime against you, and we'll get them. We'll get them in therapy. We'll get them in your dreams, but we'll get them.
Like, yeah, you just go spill a cup of hot coffee on yourself and you sue
You know,
coffee,
it's a
even though you were
litigious
stupid
healing.
enough to do it.
Somebody else is responsible. It's
It's
un-American.
always somebody else is
take-
responsible for why you are the way you are. First of all, I never even imagine creating the ideal society. I think that there's just like, I would never even go there. I would cut the dream in half, cut the bar in half and say, let's just go this high. It's not until, now I don't even talk that way. I just kind of lower the bar to realism. So what's realistic? Especially when I look at all the people I've worked with through 25 years, all the people that I've worked with their diseases and their cancers and all the thousands of readings that I've done as a medical intuitive. And I would have to say that, in my opinion, most people negotiate their healing process. And it's not just because they lack tribe, although the lack of community is certainly part of the general heartache of society in general.